According to a study by the National Multiple Sclerosis Society, nearly 1 million people in the U.S. have MS. With me today is Dr. Carolina Garcia, a neurologist at St. Luke's Comprehensive MS Center, to talk about the diagnosis, treatment, and what St. Luke's offers patients with MS. Dr. Garcia, thank you so much for joining us.
Thank you for having me.
I want to start with the basics. What is multiple sclerosis?
Multiple sclerosis is an inflammatory and presumed autoimmune condition that affects the brain and the spinal cord. Inflammation typically goes on in the brain and the spinal cord, and over time that inflammation can subside and form scarring, or what we call plaques. MS plaques are very stereotypical for this disease. It is my job as the MS physician to build a roadmap, so to speak, between these lesions and the symptoms a patient may be having in order to make the diagnosis.
And that ties into my next question, which is how and when is MS diagnosed, and what are some of the symptoms that you see?
So unfortunately, historically, there has been a delay in diagnosis, anywhere from 3 to 5 years, but our understanding of this disease has really evolved over the past decade. We know now that MS declares itself pretty early in life, early adulthood, typically between 20 and 30 or 40 years of age. And some of the symptoms that are very common with MS tend to be really localized neurological symptoms, meaning isolated vision loss, really localized weakness, localized numbness, changes in your walking, or bladder bowel dysfunction.
How does MS progress and impact a person? What do you see there?
When the diagnosis is made early in life, patients tend to be really functional and independent and otherwise healthy despite MS. But we know the longer a person lives with MS, those mechanisms that kept them upright for so long tend to not be as robust anymore, and then they really start feeling the impact of the disease.
What treatments are available for someone who has MS?
I really like to break down MS treatments in terms of 3 different categories depending on administration. We have injectables, oral medications, and infusion therapies. St. Luke's has the capacity to administer all 3 methods of treatment. Determining which treatment is right for a patient is a very complex discussion between patient and providers because there's a lot of factors that we have to consider, including age, MS subtype, where they are in their disease, etc.
St. Luke's Marion Block Neuroscience Institute has a comprehensive multiple sclerosis center. Why is it important for someone to have a comprehensive care team?
With a comprehensive care team, we can stand by the patient from the moment of diagnosis to the time that they consent to therapy and onwards, allowing us to understand where they are today and what their needs may be down the line.
Dr. Garcia, is there anything else you'd like to add today for our viewers to know about MS?
I always like to end my consultations with reminding patients that they are much more than their MS. MS doesn't have to be a death sentence. They can certainly continue to live fully functional, independent, and thriving lives despite this diagnosis.
Dr. Garcia, we really appreciate you joining us today. Thank you so much.
Thank you.
To learn more about St. Luke's Comprehensive MS Center, go to stlukeskc.org/MS Center. You can also find updates on other health news at stlukeskc.org/news. Thanks for watching. We'll see you next time on Health News You Can Use.